Knee replacement surgery has always been considered a major surgery, but now with patient-specific instruments, the procedure is a little less daunting. Dr. Charles Stewart joins us to talk about how this helps to make the surgery better for the patient in the long run. Thank you so much for your time. We appreciate you joining us today. Exactly what are patient-specific instruments?
Oh, good morning, Roxanne. Patient-specific instruments is a new technique where in the past we have used instruments that have been designed to implant the artificial knee. The trend has been to try to do this more accurately. There's navigation using computers in operating rooms, but that takes time and there's a learning curve. There now has been developed by several companies a technique where an MRI is done of the knee preoperatively before the surgery, and then specific instruments designed to fit and size the prosthesis have been designed are used in the operating room. This speeds up the procedure and most importantly, gives us a more accurate fit and accurate placement of the prosthesis.
Tell me what it, like the before and after. Before, without these patient-specific instruments, the surgery would take this long. Now it takes this long.
It takes maybe 10 less minutes, but what's most important is that the accuracy is increased. What you need for a total knee replacement is a competent surgeon with a good prosthesis, good instruments, and good pain control. We've made progress in all those. These instruments, though, now have allowed us to size the prosthesis ahead of time and make the exact right cuts, where we take 10 millimeters of bone here, 8 here. We have to align it up correctly so people have a well-functioning knee.
That's really amazing how it's done per patient. Now, does it also limit downtime? Is downtime cut?
Not particularly so, because the operation is still done through a minimally invasive procedure. The muscles aren't cut like they used to, and our rehab is very rapid now.
I was going to ask you about rehab. How quickly does a patient get into rehab after knee replacement surgery, and does it change using these instruments?
Well, I did some total knees on Tuesday, and Tuesday afternoon they were walking down the hallway that afternoon.
They are?
Yes, they're up walking.
When are they back to doing minimal activity and then normal activities?
Well, most people are back doing normal activities within a month. Some people it's 2 or 3 months, depending upon, truthfully, their fitness level.
And does this type of instrument help to maximize getting back on your feet faster?
Not necessarily. What it really maximizes is the excellent result. You have to have the implant implanted correctly in the right alignment and the right size. And this helps take some of those decisions away from us.
Is there anyone who can't have this patient-specific instrument?
People who have a pacemaker can't have an MRI. So that's really the only contraindication.
But otherwise, this is a pretty decent breakthrough, isn't it?
It's been a big advance.
And are you finding people are younger and younger getting knee replacements?
Absolutely. I did a bunch of people last week in their 50s.
So it's the more we can get this to cut the downtime and get people back on the job, back at work, and on the out doing things, the better it is. And,
absolutely.
And does insurance cover this in most cases,
yes,
Dr. Stewart?
Yes, they do. This is done outside of the operating room, so before surgery. So it's not in the hospital charges. It's all done ahead of time.
All right. Thank you so much for your time.
My pleasure. Thanks for having me.
Dr. Stewart is sponsored by Boca Raton Regional Hospital, which underwrites this segment as well. We're back with more in just a moment.